Lwalero ndabasiya nukura Mukama sumulula ebyali bisibye Lwalero oli muwanguzi Lwalero lwelunaku olw'omukisa Ofunyo mukisa mukwano ralelo
Hope Channel, changing lives.
Another beautiful Monday on Hope TV. This is Healthy Living. My name is Bibi. I welcome you once again to this fantastic program. Yes, we are here this evening to educate you about things pertaining to our health. We have professionals here. We have one in our studios this evening, and then the second person will be joining us via Zoom. I'll introduce them. The first person with me here in the studio is in the person of Dr. Victor Frimpong. He is a veterinary doctor. Hi, doctor.
Hello, Bibi.
You're welcome.
Thank you very much. Thanks for having me.
You're welcome. The second guest who is joining us via Zoom is in the person of Dr. Nanaya Sewa Adai. He is an occupational health doctor joining us all the way from North Carolina in the United States of America. Hi, doctor.
Hi, thanks for having me.
You're most welcome. And as I said earlier, today we are speaking about a very important topic. It looks like most of us, I would say, have ignored it. We don't speak much about it, but we feel that it is something that needs to be addressed. We are speaking today about rabies. Yes, I know it's common, people talk about it sometime, but we need to throw more light on it and educate others about it. You can join us via our WhatsApp line with your questions and comments on 0559-680066, 0559-680066. You can also join us. We are streaming live on Facebook and on YouTube as well via our social media handles Hope TV GH. Before we start off everything, we'll go for a very quick break. When we come back, we start with our discussion. Kindly stay tuned. We shall be right back.
If you are hard to if you have fashion mark on your first software, it can was a group myself on things. So, Santino Tank on your first software, the Enigian or Seboni and was a petty to gas say, as on the buy an Indian fee for a parewoha. If you are country, what dear Kenya may my tosum be a no, was that a tea and mint train near Cuckoo Dan, in my blue near Busia or my money are sorry you, and pay a chef in your maid door, or she will suffer soon as for my soul. Mediative fiancé, that's one say, you can one boom or the phone home, you want to do my dinner waya ma nchirima ye pa mfe ha fa hye yi ho ntoma ogefo da to so adwo no wo wasantino town ezo sorry fie ho brabo anopa no nkon pepepe ya to yensa frɛ ni ntene kudan bebrebe se omra dwumadi ya sibi osofo akosi bo acha wura akosai kwa me prempe osofo obinfo kwa me konim bo achen so bi na no nyamba beta dwumadi achibi asha asore no osofo HD aba ene asore ma ne asompenefo nyina to yensa frɛ asha ezi asore ma no adadafo nyina se momra me yempa dwumadi ho ntoma so mpenka ebo mu nchechi mu abetinya frɛ numbers yi.
Hello and welcome back from the break. This is Healthy Living on Hope TV GH. My name is BB. If you just joined us, we've not started anything at all, so you've not missed anything yet. We are discussing today rabies, and it's imperative that you watch this program and get a lot of education from it. As I said earlier, we have two guests. One is with us in the studio and one is joining us via Zoom. We have two doctors here on our program today. I'll start with you, Dr. Sewa. I hope I can call you Dr. Sewa.
Yeah, that's fine.
How are you doing, doctor?
I'm doing great. How about yourself?
I'm doing very well, thank you. Now we know that COVID has taken over the world. COVID-19 has taken over the world. How has it been for you as a doctor?
So it hasn't been easy, but things are getting better now. I currently work with COVID cases, and we've seen a drastic decrease in cases because where I currently work, most of the employees have been vaccinated, and so the vaccine is actually doing a great job. It's helped decrease the cases, the number of cases that we've had so far. So that's it.
That's good to know. So how about socially? Are you able to do any gatherings like church, weddings, and other things?
Currently, no. Mostly, I joined the church service on Zoom, so we haven't been able to go in person for our church. No weddings so far. Just staying home and trying to socially distance from other people as at now.
Right, yeah. Right. And now to Dr. Frimpong, who is with us in the studio. Hi, doctor.
Hello, baby.
You look lovely.
Thank you. So do you.
Thank you. So, doctor, you are a veterinary doctor, and
yes.
you see mostly animals.
Yes.
And so, how does it feel to be a veterinary doctor? Because mostly we know that doctors like human doctors.
Yeah, yeah. It's great. I mean, some of us, we have passion for animals, so we love what we do. Yeah. So it's quite challenging, but it's great. Yeah.
Right. Nice. Good to know. Alright. So I will start off with our topic for discussion. That's rabies, and I want to ask you, what at all is rabies?
Okay. Thank you. Rabies is an acute viral infection which can affect all mammals, humans inclusive. Yes. It's a zoonotic disease. What that means is that the disease is transmitted from animals to humans. So it's of public health importance. I believe that is the more reason why we are having this discussion. The disease is caused by the rabies virus. The virus is known to coexist with some animals in the wild. These animals may have the virus but may not show signs and symptoms of the disease. Animals such as the raccoon. These animals are mostly in the wild. The raccoon, the skunk, the coyote, and just to mention a few, and the fox, just to mention a few. But the virus can also be found in some domestic animals. Notable amongst these animals, we can talk about the cat, and most importantly, the dog. You know, the dog is man's best friend.
Yeah.
Yes, so whatever involves the dog, I believe, should get you and I worried. Because we live closely with dogs.
Sure.
Almost every household you find a dog. Yeah, so I believe it is very important we have this discussion. Yes, and more about the virus. The virus is found all around the world, on all continents, apart from the Antarctica. But it's most endemic in Africa and in Asia. Yes, and according to the World Health Organization, in a year, over 21,000 people, more than that, die as a result of rabies in Africa alone. Yeah, that is quite alarming. 21,000 people.
Yeah.
Yes. And about 99% of these cases are dog mediated. What that means is that most of these cases are the human beings or the victims acquire the virus through dogs, a dog bite or a dog scratch.
Okay.
Yes. And what makes it even more scarier is the fact that most of these, victims are children who fall below the age of 15. No children like playing with dogs a lot. Sometimes the dog may even scratch the child, but the child may not even report it to the mother or the father, and that can be disastrous. So that is something brief about rabies.
So you mentioned the domestic animals like the dog. Are there other domestic animals like the cats and other things that may also?
Yes, so the dog, but the dog is the
primary,
the common. Then we have the cats. We have even some domesticated monkeys.
Okay.
Yes. As I said, it affects all mammals, just that we see it in these three classes of domestic animals: the dog, the cats, and the monkey. There have been cases where even the rats, the rats, yes, it was infected with rabies. So all mammals, yeah.
All right, doctor, thank you for that. I'll go to Dr. Sewa. Doctor, I know Dr. Frimpong has spoken at length about what it is, about what virus causes and all that. But from the human perspective, how is it spread?
So with humans, the rabies virus is mostly transmitted when a human being is bitten by an infected animal.
Okay.
Like Dr. Frimpong said. So usually humans get their rabies virus from animals. And most of the time it's a dog. 99% of cases that rabies happen in humans is the result of them being bitten by a dog. So, yeah.
Okay, doctor. Thank you for that. Now, I'll come back.
Sorry to cut in. There are some rare cases of people contracting the virus as a result of improperly handling brain tissues of infected dogs.
Okay.
Those are rare cases, yeah, but they are documented, yeah.
Oh.
As well.
Okay, okay, that's interesting.
And also,
Doctor, you can talk, please.
Yeah, also wild animals such as raccoons and bats and foxes have also been identified as causing rabies virus in human beings.
Okay, doctor, thank you so much for that. I'll come back to Dr. Frimpong. Does it mean that all dog bites or scratches can cause rabies?
Okay, I believe this is a very important question. You don't want to create unnecessary fear and panic.
Yeah.
Yes, but dogs do bite. We are talking about a normal dog, not a rabid dog. Dogs do bite when they feel threatened.
Okay.
Let's imagine you accidentally step on the tail of a dog. Instinctively, it will bite you. Just like perhaps if I step on your foot, you may push me off. Yes. So that does not mean that such a dog is a rabid dog. And also, when dogs whelp, that is when they give birth to puppies. Some of them, they tend to be overprotective. They may not want you to venture anywhere near where the puppies are. So if you insist on seeing the puppies, it may bite you. Yes, that doesn't mean that dog is a rabid dog.
Okay.
And also, this is very common, in children. When they are feeding dogs or pets, they will give the food to the dog and they will take it away from it, like they are playing with it. Some dogs, the temperamental one, they may bite you because perhaps it may want to eat the food.
Sure.
Yes. So most of the times we investigate the circumstances surrounding the bite. Imagine you are walking on the street and a dog from nowhere, rushes straight to you and attack you or bite you unprovoked. That is quite strange, right?
Yeah.
Yes. So that is a potential, rabies case.
Okay.
So not all dog bite cases are rabies cases. Yeah.
But once you get to the hospital, it can be differentiated.
Yes. So I would advise that all dog bite cases be reported to the nearest medical hospital, irrespective of how it got bitten by the dog. Yeah.
Sure, sure. Now, doctors, this question will also come to you. I want us to talk about the signs and symptoms of rabies.
Okay.
I know that we have humans getting rabies and animals also having rabies. Since you are in the animal field, talk to us about the animal symptoms of rabies.
Okay, thank you. The virus has tropism, that is, it has some liking for the brain cells.
Okay.
So it affects the nervous system, most especially the brain cells. Yes. So because of that, most of the clinical manifestations are seen in the behavior of the animal.
Okay.
There are two clinical manifestations in animals. We have the furious type, we have the paralytic type. So what happens with the furious type is that this is, a typically calm dog. But all of a sudden it becomes overly aggressive, easily agitated. If you are in a house with such a dog, you realize that they will lose the fear they have for humans.
Okay.
So it can easily attack you, whether you are a stranger or you are the owner. Yeah, it can attack you easily. And most of the times you see them chasing after, if you have other animals in your household, you see them chasing after them. They become very aggressive. Even when you cage them, if it's a metallic cage, they'll be trying to bite the metal, try to escape, yeah.
Okay.
They'll be making a lot of noise. It's furious. It's not a pleasant sight to behold. The rabid dog, the furious type is quite scary. Yes, and we have the paralytic type. Just as the name implies, mostly the dog will become generally paralyzed. The whole body will be paralyzed. And as a result of that, the masseter muscle, the muscle under the jaw, will be paralyzed as well. So they cannot even close their jaw. So the jaw will be droopy. And as a result of that, they'll be salivating. There'll be a lot of saliva all around the mouth. Yeah, that is the paralytic type. That one is a bit mild.
Okay.
Yes, but the commonest one is the common one is the furious type.
The furious type, the aggressive one.
Yeah. So once these animals start showing these signs and symptoms, death is invariably inevitable. Yes.
Shocking. Right, Dr. Sewa, I also want you to talk to us about the signs and symptoms in humans.
All right, thank you. So the signs and symptoms in humans are very similar to that of animals that Dr. Frimpong just described. So when an animal that is infected with rabies bites human beings, the virus in the saliva enters the wound. And then from the wound, it will travel through the nerves into the central nervous system, which is the brain and the spinal cord. That's where the virus multiplies rapidly and causes a lot of damage to the brain. So the process where the virus travels through the nerves to the brain and spinal cord can be very long. It takes usually 3 weeks to 12 weeks. And within that time, the person infected will not show any signs and symptoms. And this is called the incubation period. Okay. So once the virus gets to the brain and causes the damage and multiplies rapidly to cause the damage, it travels to the salivary gland. And so this is when the person starts to manifest symptoms. The initial symptoms are like a general flu-like symptoms, such as feeling of discomfort or general body weakness. And also you can have headache, you can have fever. And with the later part of the disease, or as the disease progresses, it can result in more severe symptoms, such as you can have hypersalivation, you can have delirium, hallucination, abnormal behaviors, anxiety, insomnia, which is difficulty falling asleep. You can also have hydrophobia, which is fear of water, and also aerophobia, fear of fresh air. Okay. So these are all some of the signs and symptoms of the disease in human beings.
Okay, doctor. Let me take you back a little. We spoke about transmission from a dog bite and all that. So if a dog bites someone, the person gets rabies, can that person also transmit it to another human?
So it's very difficult for from human to transfer the disease to another human. It's mostly from animals, infected animals, to human beings through bites or scratches.
Okay, doctor. Thank you so much for that. Now, I want us to talk about the treatment of rabies. I know that in animals, it cannot be treated. Basically.
Yeah,
okay, so we'll talk about treatment in humans. Dr. Asewa.
Okay. So with rabies, there's no effective treatment once the signs and symptoms start or manifest. So the most important thing to remember about rabies is that you need to prevent it before the symptoms start to show in the infected individual. And there are two ways that you can prevent rabies from happening. The first one is pre-exposure prophylaxis vaccination. So this is getting vaccinated before you get exposed to the rabies virus. Mm-hmm. And it's usually recommended to people who are at higher risk for contracting the virus. And these people include veterinarians like Dr. Pimpon, mm-hmm. People who come in contact frequently with animals, and these animals that we've mentioned, including dogs, cats, cattle, bats, raccoons, and other wild animals. So if you are somebody who has chances of coming in contact with these kind of animals, it's very important to get vaccinated. Also, people who work with the rabies virus in the lab should also be encouraged to get vaccinated before being exposed to the rabies virus. So with the pre-exposure vaccination, it involves 3 doses. So you get dose on day 1, and then in 7 days, you get a second dose, and in day 21, or you can choose to do day 21 or day 28 of the vaccine. All right, so if you get the vaccine before you get exposed to the virus, that doesn't mean that once you are exposed to the virus, you don't have to get vaccinated. You do, but you get less vaccine as compared to someone who has never been vaccinated. So if you have the vaccine and you get exposure, it will be only 2 doses that you have to get. So you get 1 dose immediately after the exposure, and then the second dose in 3 days. Okay, so let me talk about if you've never been vaccinated with the rabies vaccine before. So in that case, if you encounter any kind of exposure, and you need 4 doses of the vaccination in addition to immune globulin. So you get a dose of immune globulin and 1 dose of the vaccine on that day, and then there's another dose on day 3 and day 7 and in 2 weeks' time. But if you are somebody who has any kind of disease that decreases your immune system, like HIV/AIDS or any kind of cancer, then it's recommended that you do a 5th dose on day 28. So you actually end up getting 5 doses plus the immune globulin dose. What the immune globulin does is that it provides immediate antibodies to fight the rabies virus, the rabies virus. Because once you get the vaccine, it takes a while for the antibodies to be developed to fight against the virus. And so getting the immune globulin at the time of treatment, the initial treatment, is very important. Okay. So with the immunoglobulin, you can administer it by through infiltration around the wound where you were bitten, and also put some into the wound. And the rest of the dose can be administered through the muscle intramuscularly. And with the administration, it's very important that you choose the right sites, because administering the vaccine in the wrong anatomical area will not make the vaccine effective. It will decrease the effectiveness of the vaccine. So avoiding giving the vaccine in the gluteal area is very important. And the most recommended place to give the vaccine is the deltoid area, right here or here. Um, yeah, so I think I answered.
Yeah, basically. And so, doctor, what's the prognosis like for rabies?
So with rabies, it's very poor if the symptoms start. Once symptoms start, there's basically nothing that we can do to reverse the damage. So usually when the symptoms start, people die within few days, 7 days. It's very fatal once the symptoms develop. So you can develop coma and eventually die as a result of not seeking immediate treatment after an exposure.
Well, I believe we are learning a lot on the show today. You can join us via our social media handles on YouTube and Facebook via Hope TV GH. You can also send in your questions and comments via WhatsApp line on 0559680066. You are still watching Healthy Living on Hope TV. My name is Bibi. We'll go for this quick break. When we come back, we continue with our discussion. Kindly stay tuned.
If my people, which are called by my name, shall humble themselves. As a soldier of the cross, you must take instructions from your commander-in-chief. You must live the way he wants to live his life. For the next 13 weeks, we'll go through the series, In His Identity I Stand. By the end of the series, we will identify who God's people are, what qualifies them to be his people, and the privileges of being God's people.
Soldier of the Cross, showing this and every Sunday at 7:30 p.m.
Hi, how is it going with you?
Hello and welcome back from the break. This is Healthy Living. My name is Vivi. You're watching Hope TV GH. Today we are talking about rabies. Yes, I know you've heard about it, but it's important that you watch this show today because you'll be educated enough, and also it will help you to tell others about rabies. Before we went on the break, we spoke at length about rabies, the signs and symptoms, what it is, how it's transmitted, and all of that. You can join us still by watching our social media handles, Facebook or YouTube. We are streaming live, Hope TV GH. You can also send in your questions or comments via our WhatsApp line 0559680066, and you try as much as possible to read and address it accordingly. So, Dr. Frimpong, before we went on the break, we were speaking about vaccination in humans. I believe there's an aspect of vaccination also in animals. If you can talk to us about that.
So in animals, I like us to limit the discussion to dogs.
Right.
Because, yes.
Right.
So in dogs, the first vaccine is given when the dog is a puppy. That's like 3 months old puppy.
Okay.
Yes, and then after it's given a booster vaccine annually. Yes. So that is that for dogs. Yes, I would like to say this as well. The United Against Rabies collaboration, that is a collaboration between the World Health Organization, WHO, the World Organization for Animal Health, OIE, and the Global Alliance Against Rabies. They set up a strategic plan to eradicate rabies by the year 2030.
Okay.
Yes, and they recommend that a nation should be able to vaccinate 70% of its dog population to break the transmission cycle. That is, if we seek to eradicate rabies from Ghana, then our target is to vaccinate 70% of our dog population, in Ghana. Last year, myself, together with colleague veterinarians and some researchers, we did some study. We sought to determine the vaccination coverage for the past 10 years in Ghana. And trust me, the results we had was quite abysmal. It's nothing to write home about, very bad. The year we did the year we had the highest was in the year 2011, and that was when we were having about 13.4% vaccination coverage. This is, we are comparing to 70%. So you can just imagine that falls way short of the recommended 70% coverage. Yes, there are some years we even did 1.4%.
Wow.
So I just want you to imagine it. What that means is that a lot of our dogs are walking around serving as potential sources of rabies. That is quite scary. Yes. Averagely, we do around 6 to 10% every year. So I believe there is much to be done. And that behooves on you and I to be responsible pet owners. As much as possible, let us do well to vaccinate our pets. You see, the dog cannot walk to the veterinary hospital to be vaccinated. The owner has to send the dog. Yes. So let us try as much as possible to get our pet vaccinated against rabies. And I don't think it costs that much. I may not be able to, tell how much it costs, but it doesn't cost that much. Yes. And once I want us to be clear on this. It is done every year.
Okay.
Yeah, it's not done once and for all. It's done every year. So if you did it last year, please do well to remember that you have to do it this year as well. Thank you.
So like till the dog dies or something, you have to be doing
every year.
Oh.
And you just pass by the veterinary. It's within some few minutes they'll vaccinate it, and that's all. You have to come back a year later. And that is, so it's not much of a worry. I believe it shouldn't be a problem.
But you initially spoke. You said that the first dose is given when the dog is 3 months.
Yeah, when you're 3 months old.
Okay, so if maybe you buy a dog that is older,
it
can you still start?
Yes. So the moment you get a dog, most of the time they come with their vaccination records. So from the breeder. So once you get it, perhaps the breeder can inform you whether the dog has been vaccinated, given the first shot or not. But it doesn't. I don't think it harms if you even still go ahead and give the first vaccine. Yeah. Then after you repeat it every year.
That's interesting. I want to ask Dr. Sewa. So we've spoken about signs, symptoms, how it's transmitted, and all that. So let's say I get bitten by a dog. What am I supposed to do?
So once you are bitten by a dog, the most important thing to do immediately is to treat the wound, give the wound proper treatment. And this can be done by washing the wound with soap and water. Or if you have other agents, such as the povidone iodine, you can use it to wash it. And once the wound is, once you clean the wound, you have to seek immediate medical care, because there's no way for you to know if the dog has rabies or not. And so you need to seek treatment. Okay.
Okay, doctor. What if the dog that bit you, the owner shows maybe a vaccine record or something? Do you still need to go to the hospital?
So if the dog has been vaccinated against rabies, then you should not be concerned about being infected with rabies, because the dog does not have the rabies because of the vaccination. I don't know if Dr. Frimpong has anything to say about that.
Yeah. Most often we have such cases at our offices. At times, if care is not taken, even results in conflicts amongst families and all that. But the most important thing is to be able to identify the dog that bit you.
Okay.
Perhaps you enter a house, there are a lot of dogs in the house. So we didn't pay close attention to the one that bit you.
Yeah.
So they can even produce any record, I mean, any book, any pet book that this is the vaccination status of the dog. So in the pet book, we describe the dog. I mean, it's according to the dog. So we describe the dog. So perhaps if I have the pet book, I know that this pet book belongs to this dog.
Okay.
Yes. So if indeed it has been vaccinated, we issue out certificates of vaccination. So once that is issued, it means that indeed it has been vaccinated. And just as she said, perhaps the only thing you have to do is, just as she said, you go to the hospital and get it treated, the wound treated. Yeah, once the dog was vaccinated in the last year, you shouldn't be so much worried. You shouldn't be concerned.
If there's no vaccination at all.
For that one,
only you and your God.
Yes. You see, the other issue is, just as she was mentioning, the post-exposure prophylaxis is quite expensive. In Ghana here, it's quite expensive.
Yeah.
So perhaps not everyone can afford it. So at times, such cases are referred to us, the veterinary doctors.
Okay.
So we investigate, the circumstances surrounding the bite and advise, most of the time, we advise the doctor in charge. If the family cannot afford that, the post-exposure prophylaxis, yes, perhaps after monitoring the dog for like 7 to 10 days, if the dog is rabid, we will see it. It will show signs of it. And we advise the doctor to immediately start with the post-exposure prophylaxis. Yeah, but if perhaps after monitoring you realize that it's not, that's why I started by saying that not all dog bite cases are rabies cases. Yes.
Okay, I'll go back to Dr. Sewa. Doctor, you were speaking about the vaccinations in humans. Okay, you spoke about the pre and then the post. I want to find out, are there any recorded side effects of the vaccine?
Yeah, so with the vaccine, the side effects are just the normal side effects that everybody or most people get from all other vaccines, such as pain at the sites of the injection. You can have some swelling, a little bit of swelling, some fever, but in rare cases, like people can have like headaches, stomach ache, but usually it should be the usual mild symptoms that result after any kind of vaccination.
Okay, doctor, thank you so much for that. So I want us to talk about general preventive measures as far as rabies is concerned. So I'll start with you, Dr. Frimpong, and then Dr. Sewa can add up.
Okay, so I would want to say that as much as possible, we should try and avoid dog bite cases. What I mean to say is that, let's say you are visiting someone and the house is fenced. I would advise that you call the person, because most of the time you may find a dog in such a house. And if you enter uninvited, perhaps the dog will attack you. That doesn't mean it's a rabies case though. But as much as possible, let us try to avoid dog bite cases. And also, anytime a dog approaches you or you enter a house and a dog runs straight to you perhaps, at times it can be scary. The dog will be running straight at you. However, I will advise that just be stationary. You just stand still. Just stand still, yes. What the dog will do is, if it's not a rabid dog, the dog will just sniff, just try to inspect you, and it will just leave you. And when it's leaving, you take time, take time before you also take some steps, Yeah, so a normal dog shouldn't be biting, just like that. You know? If a dog is behaving like that, perhaps it's a rabid dog. Yes, so that is the first thing I would like to say. We should try as much as possible to avoid dog bite cases. And also, anytime we are bitten by an animal, whether a dog or a cat or whatever animal, as much as possible we should report it to the nearest medical, hospital. Yes. So that's what I can say for now.
Dr. Sewa, anything else to add?
Okay,
please?
so what I want to say is that from what Dr. Frimpong just said, the post-exposure prophylaxis vaccine is very expensive in Ghana. And so not everybody will be able to afford to vaccinate after they've been exposed to the rabies virus. So from what I'm getting from him, the most cost-effective way of preventing the virus in Ghana is for everybody to get their dogs vaccinated, since the vaccine is way cheaper than getting the post-exposure prophylaxis vaccine. So please, everybody should try and get their dogs vaccinated, as well as their cats, because it's not only dogs that can transmit the rabies virus. So all domestic animals that are capable of getting rabies virus should be vaccinated against the virus.
Okay, doctor. Thank you so much for that. We have a few questions from our viewers, so I'll read it out and then we can answer it to the best that we can. So I think we've already spoken about it. The first person wants to know if one can survive rabies. Maybe, doctor, you can go over that for us.
So with rabies, once the symptoms start, we can say there's nothing that could be done to save a person's life once the symptoms start to develop. So that's why it's very important in Ghana for people to get their dogs vaccinated, because finances is an issue, and not everybody can afford the post-exposure prophylaxis, and that is also needed to prevent symptoms from developing. But once symptoms set in, it's fatal. That's how serious rabies is. So once you develop symptoms, that's it.
Thank you, doctor. This question also comes to you. One of our viewers wants to know why rabid patients bark.
Rabies what? Say the question again.
People that are affected with rabies, the person wants to know why they bark.
Oh.
As a sign or symptom. Or maybe Dr. Frimpong can take that for us.
Okay.
Yeah.
I don't think it's in all cases.
Okay.
Yeah, there are some cases where, as a result of the spasms in the muscles in the throat, yes, these, patients find it difficult to swallow.
Oh, okay.
Yes. And actually, Dr. Sewa said, most of the times they suffer from what we call hydrophobia, fear. The mere sight of water alone can cause these spasms in the throat.
Okay.
Yeah, so they will be, as if they are backing. They are spasms, so they are not actual. Yeah, not actual.
Okay. And then, doctor, I would also want to ask you, the dogs that get rabies, they eventually die like humans, right?
Yes, that's why I said that is invariably inevitable. Once, see, rabies, it's not something we should be, if not perhaps the most lethal disease, I don't know what it is. Once you get it, there's nothing you can do. In animals and in humans, there's nothing, no amount of treatment can save the patient. It's that serious. That is why, as doctor was saying, we should all be responsible pet owners. Let's vaccinate our dogs against rabies. And by so doing, you are protecting your dog, you are protecting yourself, and you are protecting your family. Yeah, that is the way we can eradicate it.
And how much time does a person have, or an animal have, if they get rabies before they die?
Okay, so for an animal, once the clinical signs develop, within 7 to 10 days, the animal should die. Yeah, I don't know for humans, but for animals, within 7 to 10 days, the animal should die. So, you see, the animal, you cannot intervene, because the animal may not report to the owner that it was bitten by another stray dog or another infected dog. But for the human, if it's a child and doesn't report it to the father or the mother, it's scary. But if it's an adult, perhaps the adult will visit the hospital, and some interventions can be as you were saying, the post-exposure prophylaxis and all that, to save the individual, But for animals, once the signs develop, there's nothing you can do.
And then another question from one of our viewers. They want to know at what temperature does the rabies virus die? I don't know if anyone can take that.
Okay.
So with the
Dr. Sewa.
Yeah, so with the rabies virus, they are usually killed by sunlight. And the rabies virus lies moist environment. So when it's on a surface and it's dried up, it's no longer infectious.
Okay.
It's killed by sunlight.
Okay.
But I can't tell you the exact
temperature. Right. And then this question goes to you, Dr. Sewa again. One of our viewers wants to know, I think we've spoken about it already, but we will still have to go over. He says, what are the first symptoms of rabies in humans?
So in humans, usually there's no symptoms until it gets to the brain and causes the damage, and the virus is transferred to the salivary gland. And the initial symptoms include headaches, fever, and generalized muscle weakness.
Doc, if you can go over that, please.
So what I'm saying is that in humans, the initial symptoms include headache, fever, as well as generalized muscle weakness.
Oh, so fever, general muscle weakness.
And headache.
Okay, I hope our viewer has heard that. So the next question says that I once prescribed anti-rabies for 3 children who were bitten by a dog on the same day, and the fourth child the following day. My boss queried me for not doing further investigation before giving the treatment. Doctor, please, was I wrong or not? I think, I don't know who to answer. Who will answer this? Maybe Dr. Sewa, you take that for us.
So like Dr. Frimpong said, what you can do once you are bitten by a dog is that the dog can be confined and observed for 10 days. And this is part of the investigation. So confining the dog and observing the dog for any signs and symptoms of rabies within 10 days. So if the dog does not show any signs and symptoms of rabies within the 10 days, then the likelihood of the dog having rabies is very low, and so we can skip the post-exposure prophylaxis vaccination or any kind of treatment for the infected, for the person who has been bitten. But if the dog shows signs of rabies, then treatment should be given to the individual who was bitten. So I think maybe the boss wanted them to do more further investigation before proceeding with treatment.
Sure. Thank you for that, and Dr. Frimpong.
I may be wrong, but I know there's a protocol, and that is that once a patient reports to the hospital a dog bite case, mostly from what I know, the case is referred to, after they treating the patient for the wound, the case is referred to the veterinary clinic. Okay. So the veterinary doctor in charge will confine or will investigate the dog, the circumstances surrounding the dog bite. Yes. So if the doctor finds it necessary to advise the medical doctor to go ahead and give after the investigation, and after the investigation is, I believe, it's all because of some of these cost, implications. Just as we were saying, the post-exposure prophylaxis is quite expensive. It's very
especially
expensive.
the immunoglobulin.
Yes. Yeah. So there are times perhaps you may want to save the family or the individual. You see, so what is important is the circumstances surrounding the bites. That is very, very important. So perhaps he could have asked more
Yeah.
Yes, what led to the bite. Maybe that is why, I don't know. Perhaps I may be wrong too. Yeah.
And then we have one last question. What our viewer wants to know, we are saying that rabies is deadly. He just wants to know, why isn't there much education on rabies?
Okay, so I believe this is one of the education. And so it's something we should be doing often. I mean, it's one of those neglected tropical diseases. We don't hear about it often.
Yeah.
But the disease is there. In Ghana here, well, I have seen rabies cases in humans and in animals.
Yeah.
And it's not a pleasant thing to behold. It's not at all. And so it means you have to do more public education, create much more awareness. Yes. There's much to be done, honestly.
Yeah.
There's much to be done. But the one sure way to go is to vaccinate your dog.
The dog.
Yeah.
Dr. Sewa, anything else to add, please?
Yeah, so rabies is very deadly, like we've said several times. And within a year, it kills about 59,000 people in the whole world.
Okay.
And so I think it's, I'm glad we are talking about this and asking people to vaccinate their dogs, because I think that's the cheapest way that we can do to prevent the disease in humans.
Thank you for that, Doctor. I would, before we go, I would let you say hello to your families. I'm sure maybe they are watching you.
Okay.
Dr. Frimpong, you give shout out to your family, and then Dr. Kosia, since she has been away for some time, she also give shout out to her family as well. So, Dr. Frimpong.
Okay, so my shout out to Mr. and Mrs. Kwame Frimpong Manson, yes, and to my family members, and to my staff members as well.
Okay. Thank you, Doctor. Dr. Sewa, please.
All right, so my shout out to my parents, Mr. and Mrs. Ade, Mr. Archibald Ade, and Mrs. Georgina Ade, and my siblings, Mata Freak Labels, that's my younger brother, my brother Paul Ade, and my brother Jacob Ade, and also all my Yas and Tour class of 2007 mates, and my church, Garrison, 4 Garrison in Kumasi, Ghana. Greetings to you all.
All right, Doctor.
And my church pastor, Pastor I.B. Boateng, who used to be my church pastor in Columbus.
Okay, thank you so much, Dr. Sewa. I would like, before we go, I would like to talk about the Hope Club 1000. So Hope TV launched this on the 5th of February. It's a fundraising to appeal for support for the channel. So we are looking at 1,000 people giving us 100 cedis each just to support the channel. If you are touched and you are willing, I know that the Lord will bless you marvelously. You can send in your donations to our mobile money number. That's 0249 193 083. 0249 193 083. And the Lord will bless you richly. God loves a cheerful giver. Before we go, Dr. Frimpong, your last words.
My last words will be to encourage us all to be responsible pet owners. Let's get our pets vaccinated against rabies.
Thank you. Dr. Sewa.
Yeah, so I want to encourage everybody who has a dog, all domestic animals, to please go see Dr. Frimpong and his team and get vaccinated, so that when your dog bites us, we won't get the rabies virus, and we don't have to worry about having to go through the post-exposure vaccination.
Sure. All right, I would like to take this opportunity to thank you all so much, Dr. Victor Frimpong. He is a veterinary doctor. Doctor, thank you so much for taking time to join us in our studio. Then to Dr. Nanaya Sewa Ade. He is an occupational health doctor in North Carolina, United States of America. Doctor, thank you so much for joining us. I know the Lord will bless you both, and anytime we call on you, you'll be readily available to support us. And to you, our viewers, thank you so much for making time to watch Healthy Living on your #1 Christian channel, Hope TV Ghana. My name is Bibi. As you know, COVID-19 is still with us. You need to protect yourself. If you find yourself in crowded places, please, please, please make sure you maintain your distance. Remember to always wash your hands with soap and the running water and mask up. COVID is real. Please help yourself and help others so that together we can prevent it. If by God's grace the vaccine comes to us, let's all make sure to take it, and together we can fight against the disease. I know the Lord is with us and we can fight through it successfully. May the Lord be with you and guide you. Have a good evening. Take care and good night.